Each day, more and more people are testing positive for the Zika virus. The disease is transmitted by infected mosquitoes. The most dangerous for women who are pregnant or looking to get pregnant. But the virus can cause serious birth defects. For everyone else, the most common symptoms are fever, rash, and joint pain. According to the CDC, more than 30 people have been diagnosed with the Zika virus in 11 states and the District of Columbia. The virus is also present in 23 countries, including Brazil, Bolivia, and Ecuador. Earlier today, the director of the National Institute of Allergy and Infectious Diseases spoke at the Renaissance Hotel in Washington. His message, how to avoid contracting the virus. Here's what Dr. Anthony Fauci had to say.
Zika is a disease that it is fundamentally less severe than chikungunya or dengue. So if you're going to say, don't go to Brazil because I'm afraid of getting Zika, then you shouldn't go to Brazil because you're afraid of getting dengue, which is much more serious. The issue that's the real issue is the pregnancy issue. And that should not be taken lightly, because if there is indeed, and again, evidence is mounting, that there is a true connection, that's something that has to be taken very seriously, which is the reason why the CDC did something they don't usually do. They said, you know, if you're pregnant, that we should tell you, just think seriously about postponing your travel to these regions.
Well, for more, we go to RT's Marina Portnaya in Miami, who has been diligently covering this health crisis for us.
In just a few weeks, a relatively unknown mosquito-borne virus has created global panic. Boston has become the newest city in the United States to confirm a positive case of Zika. Now, the World Health Organization, as we've been reporting, says the Zika virus is spreading explosively in the Americas, estimating as many as 4 million people in the region could be infected in the next year. According to ABC News, there are at least 31 people in the U.S. who have been diagnosed with the Zika virus, including 3 pregnant women, 2 in Illinois and 1 in New York. The virus is particularly concerning for pregnant women because it's been linked to microcephaly, a condition of underdeveloped heads and brain abnormalities in infants. In Brazil, as many as 1.5 million people have reportedly tested positive for the mosquito-borne virus since May. More than 4,100 cases of microcephaly have been reported in the country. That's up from 150 just the year before. Now, the CDC has issued a travel alert for 24 countries and territories where the virus transmission is ongoing. Colombia, Ecuador, El Salvador, and Jamaica have recommended for women to delay pregnancy until more is known about the virus. At least 2 U.S. airlines and 2 cruise companies have offered refunds to customers that were planning to visit Zika-affected countries. Meanwhile, we're seeing that in Brazil, nearly 200,000 of the armed forces have been deployed to eradicate mosquitoes. Here at home, the CDC is now urging doctors to test newborns who show signs of the Zika virus. Now, the Aedes aegypti mosquito, which is capable of transmitting the Zika virus, has been found in several parts of the U.S., including South Florida, Texas, California, and Arkansas. So far, there's been no case of local Zika infection or transmission. So on Monday, we will be hearing from the World Health Organization after they convene an emergency meeting to decide whether to declare this virus a public health emergency. Reporting from Miami, Marina Portnaya, RT.